University to be part of CEC. Sa loob ng mahigit 10 taon, I'm honored na naging bahagi ako ng kanilang dedication and commitment in providing quality eye care to all our patients. So not only in the city of Calamba, but also in the surrounding cities and provinces in the south. So you see, ito pong aming ginagawa ng mga lectures na binabahagi namin sa public ay ginagawa na ito even before I joined Calamba Eye Center. So together with the vision screening that we conduct, that we do in different schools, communities, barangays, sa mga industrial companies, we also do some lectures on the importance of having healthy eyes and good vision. So bakit po namin ito ginagawa? Since tayo, mainly as individuals, ang nakakaalam if something's not right sa ating mga pangatawan. So isa na dito yung isa sa pinaka-importanteng sense organs natin, itong ating mga mata, itong ating mga paningin. Kaya ang aming aim po is for you to know how to take care of your eyes, lalo na since we're in the midst of this pandemic, na very limited ang ating mga galaw at napakahirap po na magkaroon ng karamdaman sa panahon na ngayon. And that's the primary focus of CEC's initiative, to increase awareness and eye health literacy among our patients about the importance of eye health and good vision. Okay, so for now, may I share my slide, my presentation? Yeah. Okay. Now, can you see it, Miss Angel? Yeah. Okay. So for today's topic, I just have this disclaimer, recommendations made in this guideline do not represent a standard of care. Instead, the recommendations are intended to assist in the decision-making process. Patient care and treatment should always be based on an independent professional judgment, given the patient's circumstances. Okay, so for today's topic, I'll just be discussing tatlo po itong ating mga objectives for this afternoon. So tatalakayin natin kung ano ba yung mga batayan ng malusog na mga mata or mga healthy na eyes natin. Ano ba yung mga signs and symptoms of eye problems? At ano yung mga paraan for us to take care of our eyes. I will just be discussing with you the very basic that we do in Calamba Eye Center. It's just a part of the comprehensive eye examination that we do. When I say comprehensive, ibig pong sabihin kompleto, including all or nearly all elements or aspects of eye health. Okay, so start tayo with the first objective natin. Ano ba yung masasabi natin na tayo ay merong mga malulusog na mga mata? Okay, so let's start with your cornea. So tandaan po natin that good vision starts with the health of the corneas. Ang cornea po natin, this is the clear, transparent part of the eye that covers the front portion of your eye as protection. It helps your eye to focus also, yung mga liwanag so you can see clearly. But since ito ay nasa unahan ng ating mga mata, ang cornea natin is very prone to the risk of abrasion or yung mga scratching, na i-scrape din sila. And any injury to the cornea can impair a person's vision. It can affect the ability for us to see clearly. Kahit nalagyan pa natin yan ng prescription glasses, contact lenses, maapektuhan yung ating paningin. And we need to assess for any scratches, opacity na kailangan na nakikita natin dito. And most corneal conditions can be detected by an eye doctor through a visual examination. The second one na tinitingnan natin is your pupil. Ang pupil natin is the black circle in the center of your iris. Ang iris natin, this is the colored part of your eye. So sa ating mga Asians, we normally have this brown to light brown na irises. Itong pupil natin, it serves as a portal, which admits and regulates the flow of light to the retina, yung nerve cells sa likod ng ating mga mata. And typically, itong ating mga pupils appear perfectly round. No, it is equal in size and it is black in color. But under certain conditions, no, including those that are environmental, psychological, and medical, it's completely normal for your pupils to change size. No, it gets either smaller or bigger, depende sa mga circumstances, no? Like at night, sa gabi, our pupils dilate, no, to allow more light to pass through sa ating mga mata. In the bright sunlight naman, our pupil constricts not to a very small diameter to allow us to function normally. Otherwise, we would be very light sensitive, no? Kaya lang, sometimes may nakikita tayong mga abnormalities dito sa ating pupil. Have you seen people na namumuti, no, yung kanilang mga pupil? And this is very common sa mga elderly, no? But minsan, nakikita din natin ito in children, no? And this is an indication of the presence of cataract. Marami po tayong malalaman tungkol dito sa topic na ito sa mga susunod na sessions natin, no, about cataract. So tandaan natin, you need healthy pupils to see properly. The next one is your sclera. So sclera natin, this is the part of the eye commonly known as white. No, ito naman yung puti ng ating mata. This is tough and fibrous, no, protecting the interior components ng ating mga mata from any injury, no? And in some cases, marami din tayong nakikita na hindi siya namumuti. No, there are some discolorations of the sclera due to some systemic problems like yung naninilaw siya, no? And this is an indication na meron siyang possible na problema sa kanilang mga liver. And sometimes, in rare cases, nakakakita rin tayo ng mga bluish na sclera. And mostly, ito yung nakikita natin na namumula. No? But if you notice a color change in the sclera, you should seek advice, no, from a healthcare professional para ma-address, no, kung ano yung abnormality na nakikita natin doon. So the fourth one is yung ating eyelids. No? Ang ating eyelids have one of the most important jobs, no, in the human vision system. Kung wala ang ating mga eyelids, no, our eyes would have no protection from impacts, infections, and harsh rays of the sun. No, itong mga upper and lower eyelids natin uses skin, no, muscles, glands, nerves, and other tissues to keep the eyes mobile, moist, and lubricated. At yung reflex ng pagsara ng ating mga eyelids, ito yung nagpe-prevent sa atin from any injury. Kaya lang, sometimes, no, hindi siya nakakasara agad ng mabilis para sa mga hazard na ito. Kaya we are advised, no, by our eye professionals, lalo na sa ibang mga activities and mga trabaho natin na nagre-require ng protection, to wear, no, eye protection para mas maprotektahan natin yung ating mga mata. Ang ating pong pagkurap, no, ng ating mga mata is as natural as breathing, no? Kaya minsan nakakaligtaan natin, no, yung importance ng eyelids natin. Basta tandaan po natin, your eyelids need to stay healthy, not to protect your vision. And if you're having issues then with your eyelids like pain, itchiness, or excessive na nagkakaroon ng mga mucus secretions dyan, it's time for you to see your eye doctor upang masuri natin itong mabuti. Okay, next one is your eyelashes naman. Na tinatawag natin itong first line of defense ng ating mga mata. No? Itong mga little hairs, no, sticking out from the upper and lower eyelids natin, marami ang trabaho. Marami siyang functions. Una, no, it keeps water and sweat out of the eyes. No, bago pa yan pumasok sa mata natin, yung mga pawis na yan, dadaan muna yan sa ating mga lashes. No, yung triggering reflex na para tayo ay magsara ng ating mga eyelids, no, when insects and other threats get too close, yan din ang trabaho niya. No? and it filters dust, particles, or other pollutants to keep them away from our eyeballs, no? And also, it keeps our eyes lubricated, no? By reducing the evaporation ng tears, no? Yan ang mga trabaho ng ating eyelashes. So it might just seem like an excellent foundation, no, sa ating mga women, no, itong ating mga eyelashes, but tandaan natin na very fundamental ang role nito sa ating mga vision. And anything na mapansin nating hindi normal sa ating mga lashes, we need to seek consult also, no? Kasi sometimes ang tubo ng lashes natin baliktad, no? Minsan papasok siya because of some certain conditions, no, na kailangang ma-address yun. Kung hindi, tatama yan lagi sa ating mga cornea. Okay, so next one is tinitingnan din natin kung yung direksyon ng ating mga mata. Diretso ba ito? No? In order to achieve normal binocular vision, kailangan yung eyes natin kailangan makakita ng maayos. They must be aligned, no? They look in the same direction and they need to be focused on the same object. Now, but to maintain alignment, the eyes must also move in coordinated manner, no? And that's one of the reasons, no, kung bakit yung binocular vision natin is very important kasi it allows us to perceive depth and relationships between objects. At ito ay mas matatakel din ng ating pediatric ophthalmologist sa mga susunod na days ng ating session. Okay, so next one is normal vision. Now, ang vision natin, or also called visual acuity, this is tested by reading an eye chart, no, at a distance of 20 feet. And ang common test for visual acuity is the Snellen eye chart. No, ano bang ibig sabihin, no, pag sinabi nating normal yung vision ko? 20/20 naman yung vision ko, no? Having 20/20 vision means you can see objects clearly from a distance of 20 feet. No? Ito ay measurement of the clarity, your sharpness of vision. And if you have 20/20 vision, no, you have a clear view of things that are 20 feet away from you. No? Pero tatandaan natin pa din, no, na this is not the full measure of vision, no? But it's just a factor that is taken into consideration when judging a person's ability to see, no? Many people kasi believe that kapag nagka 20/20 vision na sila, nabasa na nila yung number 8 sa Snellen chart, no, they have this perfect vision. But that's not the case, no? Marami pang factors for us to determine how well you can see, no, including yung eye focus natin, no, yung eye coordination natin, yung eye teaming or tinatawag nating binocular vision, yung eye movement, and yung color vision natin. So the entire picture involves all these different parts and they help determine how good your vision really is. Now, but the best way nga to determine the health of your eyes is to get a proper examination that can measure the different facets of your eye health. No? So, ito ay ilan lamang sa mga mga batayan natin or basis na medyo maganda pa yung vision ko, maganda pa yung aking mata, medyo healthy pa rin siya. But tandaan natin na kailangan natin ding bantayan, no, yung mga signs and symptoms na meron tayong mga problema sa ating mga mata. Okay, so una, no, yung ating minsan may nakikita tayo ng mga pasyente, no, talagang excessive yung kanilang tearing, no, sobra yung kanilang pagluluha. So ang ating tear glands, ito ang nagpo-produce ng luha natin. At ang tear ducts, no, yan yung nagke-carry ng tears natin from the glands to the surface of your eye. Kaya lang sometimes nagkakaroon ng problem, no, dito sa daanan ng luha natin. No, nagkakaroon sila ng sobrang pag-produce ng luha, and sometimes nagkakaroon din ng kulang naman ng production ng ating mga tears. And treatment ng problem na ito depende sa causes, no? Kaya kailangan mas masusi ding pag-check up ang kailangan natin, no, sa ating mga doctors, no. If you notice that you have any symptoms, no, na minsan ay baka nagbabara yung daanan ng luha natin, it's best for you to see your doctor, no, in order to get the treatment that you need. Okay? Minsan kasi napakahirap, no, sa ating mga yung luha ng luha, napakahirap at hassle, no, having to constantly explain to people that you're not actually crying. No, sometimes may problem ka lang sa iyong daanan ng luha. Okay, so next one is yung pamumula ng mata or eye redness. Okay, ito ay very common, no? Minsan tinatawag natin itong pink eye or conjunctivitis. Now, this is a fairly common condition with many possible causes. Now, they can be classified into several types. It could be viral, bacterial, allergic, chemical, autoimmune or inflammatory conjunctivitis. So mainam, no, na mapasuri natin itong ating mga mata kapag tayo ay may pamumula, no, or redness. Tandaan lang natin na some of these types of redness is contagious or nakakahawa. No, it can spread through hand-to-eye contact or contaminated objects. Kaya panatilihin din natin yung kalinisan or proper hygiene natin. No, kapag may pamumula ng mata, never instill, no, yung mga eye drops na hindi prescribed ng inyong mga doctors, no. Tanging doctors lamang ninyo ang makakapagsabi kung ano ba ang nararapat na gamot para dito. But I just want to warn, no, may isang condition tayo sa ating mata na tinatawag na glaucoma, no, or pagtaas ng pressure sa loob ng ating mga mata. Ito ay meron ding presentation ng symptoms ng redness accompanied by eye pain. So kung ito ang ating nararanasan at hindi natin tiyak, no, kung ano ang dahilan ng pamumula mo, ng mata mo, so better consult your eye specialist. Okay, may isa pa, no, tinatawag nating photophobia, yung madali siyang masilaw sa liwanag. And this is a troublesome symptom, no, that can usually be managed with lifestyle adjustment. No, magsuot ka lang ng sunglasses mo, okay na. Or kaya i-dim mo lang yung light mo sa inyong mga rooms, okay na. But tandaan natin, it can be a sign of serious medical eye problem, no? Ang common eye conditions that causes photophobia include yung cataract, glaucoma, no, yung mga corneal abrasion, no, may gasgas pala yung cornea mo, uveitis or some other infections and inflammations. Kaya better, no, to consult your eye doctors din, no, for them to check the underlying causes ng ating light sensitivity. The next one ay yung pananakit ng mata natin. No, eye pain is a very common symptom. And there are many potential causes, no, ranging from serious ones like katulad ng na-mention ko kanina, yung glaucoma, meron pa yung tinatawag na optic neuritis, no, and to less serious ones like yung mga conjunctivitis or may kuliti lang sa mata or dry eyes, no. At hindi natin din to kailangang i-ignore, no, ang anumang senyales or symptoms sa ating nararanasan, no, upang ma-address agad ang mga conditions katulad nito. No, kailangan nating alamin kung ano ba yung quality ng pain niya, no, ano ba yung associated symptoms ng eye pain na ito. So kailangan ma-address ito, no, ng tama ng inyong mga professional doctors. Okay, have you seen children, no, mostly sa children ito, sa mga kabataan, no, yung napakalapit nilang magbasa or magsulat, no, or manood ng mga television. So kailangan pa nilang lumapit, no, sa mga screens, no. Itong mga symptoms na ito ay mga indications of error of refraction or yung panlalabo ng ating mga mata, no, katulad ng myopia. Ang myopia ay isang uri ng condition sa mata na mas kilala sa tawag na nearsightedness, no. Ibig sabihin nito ay nakakakita tayo ng malinaw sa malapit, pero malabo ang paningin natin sa malayo, no. May isa pang condition tinatawag na hyperopia, opposite naman ito ng nearsightedness. Ito yung tinatawag nating farsightedness, no. Isa itong condition na kung saan ang isang tao naman ay hindi makakita sa malapitan, pero clear, no, yung kanyang vision sa distance. No, meron din tayong